everybody. Today here in Dynamic Talks, I have Dr. G, another Dr. G, not myself, of course, Dr. Giardina, right? I hope that I pronounced that right. And he's a psychologist, and he works literally 2 blocks away from here, from Dynamic Psychiatry. And we're going to be talking a lot about emotional health, a lot of stigmas, myths, and how to break away from that. So I have Dr. G with me.
Thank you so much for letting me join.
People have this misconception that Xanax is a solution for anxiety, and it's not. Xanax is a medication that is only FDA approved for short term.
If you're relying on that medication and you're taking it that frequently, well, then we should be learning a different way of coping.
Right.
And if your only way of coping is to go to the pill, that's when the abuse really starts to happen, because now your brain thinks this will make me feel better. But if we can teach you other things that will make you feel better, that are not substances, if you can go take a hot shower, go take a walk, or go hug your dog, well, now that's going to produce a similar calming effect, and that we didn't need to go to the pill. All right, so let's dispel the other big myth. It's everybody's got opinions about ADHD. And is ADHD being diagnosed more, or are we just living too crazy a society where we're overstimulated? Is it that we're all trying to use Adderall or Ritalin or whatever the hot thing is to get ahead? And that's maybe a little controversial. So this is Dr. G's opinion. This maybe isn't the opinion, but what do you see in your practice? Because my perspective, I'll put myself on the hot seat first, is that I think we're better at diagnosing things. That's why we're seeing things more. But I also think that the system doesn't necessarily support, I don't treat children, but when I look at the incidence of this in children, I think that the way that my daughters go into school, they barely get recess. And there was an interesting study I remember reading years ago, that there's this one county in Georgia that the kids still had recess, and that school system had way less ADHD diagnoses because the kids had an outlet and they weren't expected to sit still all day. And I think we're in this, society where we're supposed to sit at a chair or a desk all day and nobody's moving. So that's my 2 cents. But I don't know. What do you see? What do you think?
I don't see children either.
But adult ADHD now is, everybody asks, do I have adult ADHD? Or is it just TikTok making me feel like it?
I would say, you know what? It's interesting. I would say after COVID, I don't know, obviously COVID came and, changed the world of mental health, and social media forever, because everybody was housebound. So we didn't have anything else but social media. Right. So everybody started spending a lot of time on TikTok, Instagram, on these platforms, right? So of course, sometimes if you start seeing the same propaganda, eventually you're going to start thinking, oh my God, do I have ADHD? Should I talk? Maybe something that never popped in your head before, but I thought that you never had, but you start seeing it so frequently. Everybody was talking about. Yeah. There were all these advertisements on even on TV. There were all these companies. Yeah. Well, that's why now we have a shortage of Adderall and other stimulants, because during COVID, ADHD was blooming and everybody was getting stimulants because a lot of people were working remotely.
Right, which I think it's a situational change. It's not that you suddenly got ADHD, but you're not talking with somebody at the water cooler. You're not walking around your office building. You're not
interacting with anybody. Exactly. Stuck in your house. And maybe your children are also at home, and becomes so challenging to work and concentrate, right? Your spouse is at home, everything changed.
And I think, and that's my opinion, but again, I'm picking at yours, that did we all suddenly as a society get ADHD, or is it that? And that's something I like to dispel with my patients and with listeners, that if enough people have something, then it stops really being a disorder. If we're all addicted to our phones, well, then it's not an addiction, because we're all doing it. I'm doing it, you're doing it. So, right, it's common.
Right, exactly.
And I think we suffered that as a society, that it shifted. Yeah. Now, so then if somebody comes in and they explain, I have a little bit of difficulty focusing at work. Where's the cutoff for you? When do you say, okay, we need medication, versus, well, maybe you should go for a walk, or maybe you need to, change your work setup?
It all comes down to, is it really impairing your activities of daily life?
Okay.
And that means, are you able to perform at work? Are you able to meet deadlines? Are you able to, turn in your projects? Right. Are you able to keep up with meetings? And now we switch to home. Are you able to do chores at home? Or are you able to pay your bills? Certain things that you need to be able to keep your activities of daily living in track, right? And the answer to all those things, the majority of them are yes. You're able to do those things, then there's no medication just go and exercise. I always say, go and exercise, take a walk, go to the beach, meditate, yoga.
Yoga is medicine.
Yes.
But I
More holistic, natural approach.
and again, throwing in my 2 cents, I think it's and put the phone down. Because I'll have somebody say, well, I was at home and I was going in the other room and I was going to go put away some laundry and I got distracted and never did it. What distracted you? You were holding your phone and then it pinged and then you looked at the phone and it was something else and you forgot where you were going, but it's because you got interrupted. And I think if people would just put their phones on do not disturb or only check the email once every 15 minutes, if you're, and the example I give is if I said, okay, Dr. G, I want you to say the alphabet backwards. But if every few letters are went 7, 11, you're going to get distracted. And it doesn't mean you have ADHD. It means this is an impossible task.
Yeah.
Right?
You know, ADHD and some of the symptoms of ADHD can be mistaken for anxiety. I see it very frequently.
Yes.
You know? So we got to be very careful, and that's why it's important to spend time with your patient, talk to them.
Yes.
Because if I only see you very briefly for 20 minutes, and you're telling me ADHD, sure, you have ADHD,
Right.
but maybe you don't have ADHD, maybe you have anxiety. Maybe there's something else that you think that is ADHD because that's where you've been seeing on TikTok.
Right.
Right? That's where people are talking of your coworker told you, hey, you have ADHD. And then you already had that in your head. So that's why it's so important to go and speak with a professional. Take the time to actually explain, you know, and see and start understanding what symptoms you actually have. Because some of the ADHD symptoms overlap with anxiety.
And that's where your training comes in, because it's understanding that there are symptoms that may be similar, and also understanding, and people who aren't trained who are listening to this, they wouldn't know that, but having one symptom of something doesn't mean you have that.
You will have it.
Right now, you and I both sitting here have a few symptoms of a couple illnesses, but it doesn't mean that we have the illness.
Correct.
Right?
And it all comes down to, like I said, is it affecting your activities of daily basis?
Yes.
If it's not, then you're okay. You're human. If it's not, you're human.
Yes.
Okay?
But what I think it's tricky there, and I imagine you and I have similar clientele. I have a lot of folks who don't want to, they're not even just dealing with illness, they want super wellness. We have people who are trying to get to optimal living here in Coral Gables. And I think it's, I'm doing fine. I'm doing the ADLs, but I want to be doing super duper.
Right.
I want to get by on 4 hours of sleep so I can be room mom, but also CEO, but also super fit. And like, I think we're almost like sometimes demanding.
Healthy.
Yeah, you're demanding too much of yourself. Like if you need to rest, you need to rest. If you can't do it all, that doesn't mean you need a pill to do it all. Right.
What do you expect and what do you want? There's certain things that are achievable and there others are not.
And some of it is accepting reality of society, but also who are you? Yeah.
And your limits.
Yeah. You're trying to keep up with the Joneses, but the Joneses do things differently. And that's something I really try to emphasize on my patients too, that like we all have strengths and we have weaknesses. And sometimes what you think is a weakness might be your strength.
Correct.
I have many patients who, I'm not an ADHD specialist, so I can't even speak to this really knowledgeably, but I wonder, are you distracted or is that how you get creative? Because I've had some folks say when they start the stimulant, then they are more quote unquote productive, but they can't create. They can't so that thing that you think is holding you back in maybe a corporate setting, in a creative setting, maybe that's your superpower, right?
Correct. You know, and maybe it's just anxiety, or maybe that you're sleep deprived, you're not sleeping at all.
What else is
So
it?
many factors. Some are maybe substances. Some people think that they have ADHD and maybe they're just, talking about substances. They're just like smoking too much. They're doing pot. They're doing other,
Right.
And that is just contributing to the symptoms, right? Because then you have the crash or you have the high, the highs and the lows.
I was treating a gentleman and he thought he was depressed. He thought he didn't like work. He had the Sunday scaries. Long story short, we come to find out that he was using cocaine pretty regularly on the weekends. So he was just coming down from cocaine. Yeah. And it feels like depression because it's the flip side of that.
Right.
So you're not depressed. You're just doing too much cocaine.
Yeah.
And when we quote unquote fixed it, right? But it's not what you thought it was.
Right.
So while we're talking about substances, Dr. G, now there's more push towards using what used to be like recreational substances in mental health treatment. There's all this research around using ketamine, which used to be it's a horse tranquilizer, but it became a party drug. Psilocybin, magic mushrooms. So do you work with any of that? Do you have opinions on that as a psychiatrist? Are there cases that it makes sense to go some of these routes?
I don't do any of those procedures in my office, but I'm not against them.
Okay.
I think there's certain conditions and there's certain situations when certain patients would benefit from ketamine or psilocybin, In fact, there's a medication that is FDA approved that is called Spravato. The generic is ketamine. That is FDA approved for treatment-resistant depression and suicidality.
Yep.
So yeah, there's been research. There's that they've gone and have gotten FDA approved. So of course, there's certain substances that have indications for to improve, but it's usually in treatment-resistant cases.
So can you explain what that means, treatment-resistant?
Treatment-resistant means that you tried the standard route of medication, which means one or two medications, usually an SSRI or SNRI.
Okay.
And you have not, an adequate dose for adequate duration, and you have not felt better.
Okay.
You continue to feel depressed.
So we should be jumping right to ketamine.
This is not first line.
Yeah.
No, it's not. This has not been approved as first line. First line for depression and anxiety are SSRIs.
And we were talking before the podcast, so I'm going to prompt you here again that there's definitely, we need to consider that these can be phenomenal treatments when done medically supervised, right? This is going to a music festival or in the forest or hanging out with your friend is not the time and place to be trying these things and thinking it's medicine. If you're doing it recreationally, well, then that's your...
It's a whole different story.
But this is, it's not treatment unless you're doing it under guidelines.
Correct. Because what happened is, we were talking about it, there are all these companies online where you can sign up and you can get ketamine shipped to your house.
Yeah.
Under no supervision, and you're going to do the treatment yourself. But you're not a medical professional. How will you know what to do or what to expect? How do you know if you're having a complication? How do you know if you need to go to the hospital? You wouldn't.
Right.
You wouldn't, because you're not being monitored by a professional.
And I think that's very different than I do like that COVID brought on more telemedicine, and it's neat that you can do a telepsych visit. I think there's some circumstances I'm not really comfortable with it, but if you need a pharmaceutical refill for your Lexapro, sure, let's do a telehealth visit. But mailing you ketamine when you're not even my patient, you're getting it from a company, and you're just having a chat with somebody on Zoom seems a little...
15 minutes.
Right. Yeah, and then good luck. Yeah.
Right. Do you think that you can be properly assessed and evaluated in 15 minutes? No, you can't.
And this is where it's a shame, because I think that could be a very useful treatment for a lot of people.
Absolutely.
But what are the circumstances?
Right.
And are you in a safe environment? And is this your first attempt, right? Maybe we should try Zoloft first before we try mail or ketamine.
Right. Exactly. It's there are guidelines in place because that's what's being studied the most, and that's what's shown the best success rate with the least side effects. We'll put it like that. Okay? So that's why we have guidelines in place. Yeah. So let's follow the guidelines, right? And then if that doesn't work, then absolutely go and try, ketamine, but go to an actual office where you're going to be monitored by professionals, where you're going to be properly assessed, not just in your home.
And so in kind of conclusion, let me ask you, what we've sort of touched on it, whether we're talking about the plant medicines or, what TikTok is showing our algorithm, but what do you see as the next phase? I mean, you're a young physician. You're in a different generation here. So what are you seeing? I mean, maybe even medical school, you saw different things, but where is this headed? Whether it's psychiatry or mental health, what do you think is the next thing we should all be kind of getting on board with?
I think that we're headed in a pretty good direction.
Okay.
You know why? Because we're talking more about mental health. Yeah. That's what we're doing. More people are talking about it. Yes. Not necessarily that all the information that's being shared is accurate, but at least we're talking about it.
It's in the conversation.
20 years ago, nobody was talking about mental health. Nobody was giving the importance that it takes and the importance that it is to feel good on the inside. Everybody gave importance to feel and look amazing on the outside in medicine, which is extremely important, but so it is to feel good on the inside.
Yeah.
I always say the brain is the most important organ that we have. It either makes you or breaks you. If you have your thoughts aligned, if your thoughts are positive, you're going to make it very far. If your thoughts are negative and pessimistic and you're always catastrophizing and you're not organized, it's going to be very, very challenging for you to make it. So it comes down to let's do and feel good from the inside out. And how do we get there? Talking about it. People will realize, okay, it's normal. Other people are feeling like this.
Yes.
I don't have to keep it in. I can release. I can share. I can talk about it. And then that'll make us feel better. and that'll help us get help, right? How do we get help? By asking for it. How do we ask for it? Well, we gotta realize that it's okay to ask for help.
Yes. Yes.
But how do we realize that? Well, there has to be people talking about it.
That it's not just me. That it's
That it's just not me. It's just not in my head.
right.
Just remember to talk about your emotions, to take care of yourself from the inside out, and to break the stigma of mental health by continue talking about it.